think we're almost live, if we're not live already. Sorry for the last minute run in here. Family, kids.
Yeah.
Okay, it's getting Dr. Hooper. And let's do this. I think we're live, actually. Okay. Can you guys hear me okay?
I hear you.
I hear you.
That's over here, Doc.
Seems like... Okay, now things should be straight. Hi, everybody.
Hi.
Sorry.
Hey there.
Okay. Today is the last day of Obesity Care Week, and we are extremely lucky, extremely blessed to have 3 wonderful patients with us today. And Dr. Hooper is now here. I sent her the wrong link initially. I apologize, Dr. Hooper.
That's okay.
We have our 5 people here, our 2 surgeons and 3 wonderful patients. Today is day 7, our final day of Obesity Care Week, and the theme for today is I Care. And we try to show the public, try to show our patients all the time that we are invested in their short and their long-term health, and that really this is about health. But we thought that today would be a good opportunity to really make sure that we profile some of our patients. And so I'll let Dr. Hooper say a few words, and we'll go from there.
Thank you for sending me the right link. I'm really happy to be here, and thank you 3 for joining us, and everybody watching at home. I hope that, if you maybe think that your story isn't worth telling, or that you, for people watching that, maybe you haven't had the same issues, I hope that just hearing from other people reminds you how proud of you we are, and how impressed we are with the strides you've taken to improve your health, and how privileged we both feel to be part of that with you. We get to do a lot of pretty amazing things as physicians, and it is very, very rewarding for us to say, how are you? And to hear back, I'm great. My diabetes is better. My high blood pressure is easier to control. Or I got down on the floor and played with my kids and I got back up without help. Or I'm going back to work. I saw that yesterday on our Facebook page for someone who hasn't been able to work. So I just really want to say thank you to all 3 of you, and to all of our patients. We have such a warm spot in our hearts for all of you, and we're so proud of each and every one of you. And so we'll get some kind of representative stories from our patients today about who they are, why they did this, and how their life is different now.
So yeah, I'm not sure what order we'll go in here. So I'll let each of the patients or the introduce themselves, and then see who wants to go. This is an open forum.
Well, I'll go. I'm Charlene McNabb. I had my surgery October 31st of 2019. And yeah.
Halloween surgery, huh?
Yeah. Good times.
Good time to have surgery.
Yeah, I had to plan out. I know I was hiding from all the candy. I had to plan out people taking my kids trick-or-treating because they were like, what?
The most aggressive way to avoid eating candy on Halloween is to schedule your surgery for that day.
I know. It's like, stay in the hospital. Don't look at it.
Anybody else want to introduce themselves?
Sure. My name is Milan Deneen, and my surgery anniversary was actually yesterday. Was my 3 years. It's actually my birthday. I had surgery on my birthday, so that's one way also not to have cake and ice cream. Yeah. And I had the dual denal switch actually, so just so you kind of know.
Hi, I'm Dolores Spicer, and I'm 3.5 years out, November of 17.
and I had a sleeve, and I'm 85 pounds down.
Awesome. So, Charlene, tell us about your journey, why you did it, what got you to decide that you wanted surgery.
Oh, okay. Well, I have been overweight my entire life. It kind of started when I was about 9 years old. So I went from being kind of an average sized kid with all the rest of the kids to all of a sudden I gained like 30 pounds in a summer, and I was a lot bigger than everybody else. And there was no reason. I was outside playing with all my other friends and stuff, but I was eating all the junk that all the other kids were eating too. But I was on soccer team, softball team, did all the stuff, but I gained weight, and no one really knew why. No one could really answer why. The doctors were just like, it'll go away, as she gets older. But by the time I was like 12 or 13, they were able to figure out that, and they were doing studies and finally came into realization about PCOS, and they diagnosed me with that. And they were like, that's probably about the time all your hormones and stuff started going, was when you were 9. And so I gained a lot of weight, and I've just kind of always been bigger, and it's just was a part of my life. And I was active. Like I said, softball, soccer, things like that, my whole into high school and everything, and just stayed bigger. All the way until like when I was in high school, I heard about bariatric surgery, and I wanted to try to have it even in high school. And they were like, you're underage, you can't have it. And I was like, oh. My mom even tried to help me, and my dad's insurance was very much against me having it. And so I kind of laid off of it for a while, and I'd been trying to have it gradually. And finally, I had my 2 kids, and I had been on different diet plans and things as I had been trying to be aggressive with it for a long time. And like I said, working out and doing things, and it just wasn't working. So I finally got to a point where I was just like, whatever, man, I'm just going to be bigger. I'm bigger. It's what it is in my life. Then I had my kids, and I was like, I got to do something for them, because I can't play with them. I can't keep up with them. I can't enjoy my life with my family. And so I finally was like, I want to look into it again, because trying to diet and doing things just wasn't working out. So then I started looking into it again, and that's when I found minimally invasive. And yeah, and I was about at my heaviest when I first started. I was at about 475 when I initially contacted you and started with everything. And I think on the day I had my surgery, it was like down to like 420.
Yeah, if I'm not mistaken, I think your first consult, your whole family was there. Your husband was there.
Yeah, my mom and
your mom. Yeah,
yeah. Yeah, my mom's very involved in my stuff. So
it was a lot of people in a very small room. Pre-COVID, we could do that.
Pre-COVID.
Yeah, pre-COVID for sure. Pre-COVID.
Yeah, for sure. So you were 420 on surgery day.
Yeah, and then surgery day, it went good. It got done. Got handled. Everything done. Got home. I've had my ups and downs with me after surgery. I've seen Dr. Caucasia a lot more than a lot of other people have seen him after surgery, to be honest. But things happen, and I was very much aware. Like my mom, like I said, she's very involved medically with a lot of stuff. She had cancer and stuff, so she gets very into like looking into what could happen and stuff. So me and her had gone over stuff. Dr. Caucasia had gone over stuff with me, so I was knowing that things could happen. So about a month later, I had what we figured out was a stricture. So about Thanksgiving, I spent some time in the hospital till we figured out we needed to expand. My hole was closing up to where I couldn't even keep down liquids. I had to make it a little bit bigger, but it worked out, and so I was back and fine. But my insurance one covered for me to get my gallbladder out. So about springtime, I needed to have gallbladder out because, that happens. And Dr.
Caucasia
explained, you explained it out. So it happened. So here we were. I was like, you need your gallbladder out. So I started having some issues. So I was like, okay. So get that out, and then of course, being me and my luck, I'm a weirdo and had some kind of weird stuff going on in there, and then about a week later, I was like, man, I feel really bad. So I ended up.
You've definitely had an interesting go at it for the last year.
Yeah, but I just had to go back in, get some stuff handled. But it's what it was, and in the end, I've had people ask me, they're like, was it worth it? I'm like, it was worth it, man. I'm like at 245 now.
Wow,
so
it's pretty much 200 pounds down from your highest.
Yeah, so I'm like, and I'm still rolling, and I raced my 5-year-old the other day. She was like, let's race to the car. And it was something I would have been like, nah, I can't. And I would never have done. So, but I was like, yeah, let's race. I'm going to beat you. So I like took off and I ran to the car, and I was like, I beat you in your face. And she was like, Mom. And I was just like, yeah. So I was just like, so everything last year with going back and the stuff, and then the COVID stuff. I've had more tests done last year with COVID than probably a lot of other people. And people were like, do you have it? I'm like, I for sure don't have it. I went to the hospital several times and had my test done. So it's like, I know I don't. I work at home. But yeah, like being able to race my kid to the car the other day was the best. And being able to go and play with them, just, it's topping on the cake. So that's about me.
I think we have a new visitor join us, a new guest. You want to go ahead and introduce yourself?
Hello, I'm Frances Selmer. I just had the surgery 6 weeks ago, so I'm 6 weeks post-op. But I'm very glad I made the decision. I've already lost a considerable amount of weight for me. And my journey started about 2 years ago when my son, who's 27, and he'd been in the Marines and had been deployed, and he came home. His grandfather had died, and he's like, Mom, I want you to be around when I have grandchildren, because both of my parents died young, and I believe part of the reason they died young was obesity. And so that really convicted me, and then it just kind of went from there. I started on the journey, and I was supposed to have the surgery in December, but I did get COVID. And so I was so mad. I'm like, I wear my mask all the time. How did I get this? And anyway, I survived it and had it a month later. And I have no regrets at all. I'm looking forward to losing more as I go on. My husband and I planned a trip next month to Arizona, where we're going to actually do hiking. And to be able to do hiking when I haven't been able to do that in years, I'm thrilled that I'm able to do that. So anyway.
Awesome. Milan, you want to go?
Sorry, I was taking it off of mute. Yeah, congratulations on your weight loss. That's awesome. 6 weeks was a bit rough for me, not gonna lie. But so I had my surgery March 5th. My birthday was the day I turned 31. So yesterday I turned 34, and it has been a really amazing journey. So this journey for me, I think, started more like 5 years ago, maybe almost 6 years ago, because I'm a veteran, and so I had to use the VA to help me through the VA Healthy Choice. And that program is awesome. Without that program, it kind of really truly did give me not even a second chance at life, but like literally another chance. I'm just full of chances over here. So I think when I went into surgery, I was 200. I'm gonna call it 230 because it was 229.8. It's 230. And then I think I got my lowest that I got down to was like 158. And right now I'm steady at like 176, 175. And I'm constantly trying to watch what I do. I have a new job that I walk over 5 miles a day. So I'm really stoked about that because I don't like the sitting sedentary kind of thing. I can't do that. But this has been really a phenomenal thing to happen for me because it took me about 2 years to get to Dr. Kukrej's office. So when I met him, he was like, I guess like a knight in shining armor, like for real. Because he had his scalpel and everything. You know? But because of the surgery, like duodenal switch surgery, I forget. I think it was like 74 pounds. I can I think it's her name Charlene. I play with my kiddo now, and we actually want to try to have more kids. We were cleared for it last year, but like Charlene said, COVID caught us up, so we are cleared right now to try to expand our family. I take my vitamins on a daily basis. That's something that Dr. K and his team made sure, like, for us to know, like that is so important for us. And there was a time that like everybody else, I'm sure, that we slip up and we're like, oh, do I have to take the pills again today? And so like for a week, I didn't take it. And I was in school. And so I was like, you know what? I need to get back on my thing. And sure enough, you really do feel the difference. At least I did. So I was like, I'm never going to do that again. And it's good. It's well money spent because it is literally life or death. I think for
especially for DS patients, you're absolutely right.
Yeah. And I feel like 100 times better knowing that we have a dietitian, Kyle, to talk to because, like I know when you first have surgery, I lost all like desire to eat. I wasn't hungry, but ghrelin, that hormone ghrelin, it definitely came back. So I'm like trying to figure out different things on how to make myself less hungry and just not really think about it. For me, it's more of like a mental issue or concern, I guess, and just really finding other ways to channel that. So I like to stay busy. I like to work out. And when COVID happened, it like took that away from me, like the gym piece, but it didn't take the outdoors away. So we've been able to experience more outdoors, hiking and swimming, and now I rollerblade. I'm 34 and I rollerblade, so it's awesome. Try it. But yeah, I really appreciate Dr. K and his team for sticking with me and just really just like supporting us through this whole thing. Because at first it was I wasn't used to the pain, and I know I didn't complain about it, but boy, it was something. So,
and I think your story is quite interesting, especially because people in the military. I mean, you guys were. You guys know how to exercise, right? I mean, you know how to go to boot camp, and despite that, we know that. I mean, we in medicine, people who have gone through this, know that this is not an indictment, right? This is not a matter of food and exercise. This is the body's response to normal environmental factors, metabolism. This is not a finger pointing contest. And so to tell people that they could do it on their own, I think is a little bit, maybe a lot of it, naive and unfair.
It is, yeah, especially because, I had my son when I was active duty, and so I gained about 80 pounds. They want you to lose that 80 pounds in 6 months, but it took a while to gain. So I started taking care of myself as soon as my son was born. And even then, even being active duty, I mean, boy, we work in 16, 20-hour days. It still wasn't possible. And so I was like, okay, well, I'm going to look into this years later after I got out. And it really has helped because I was working out. I was running. I'm an avid runner. I love to run. Probably one of the only people that I know that likes to run. But
I'll run if somebody's chasing me.
Yeah, no matter what, it just didn't make a difference on the scale and or my clothing. And so I was like, okay, I got to do something. So I need some help. And I started asking around, and that's what the VA put me towards. So that's definitely a positive program for many veterans, not just myself. I know several veterans who are getting into that program. I'm glad Dr. K is the one that we end up with at the end.
We've taken care of a lot of vets over the years, both when I was working at the VA and now they still send us some patients here and there. So it's definitely a good program for our veterans.
Yeah, thank you, Dr. K.
No, thank you.
Thanks for sharing all of that.
For sure.
Dolores, I guess you're in and out. You've got some technology issues, but we're here now. We'd love to hear what's going on with you.
Well, actually, I'm doing good. Um, getting over the gallbladder issues. Um, like Milan said, was it? No, it was Charlene had to have go back in and have her gallbladder out. Well, you did mine in November. Um, Ended up having some issues with that, but all in all, I'm doing good. I walk a lot, especially now that the weather's nice, where we can get back outside again. Um, um, I came to see you. I was like at the bottom of the barrel. Um, I'd gotten into a really bad depression. Just the weight just kept piling up and piling up and piling up, and um, I was having a lot of trouble with my legs. My legs were hurting so bad all the time in my back, and I went to the doctor, and he's like, "You got to get the weight off." Well, I'd done the Weight Watchers, the Nutrisystem, the Adipex, everything, and starvation. You lose 10, you gain 20, and nothing seemed to help. And he said, "Well, um, would you be interested in a weight loss clinic if I sent you to one?" And he sent you, or sent me to you, and you kind of saved my life. You gave my life back.
So I don't know if you guys saw this yesterday or today. Jillian Michaels. You guys remember Jillian Michaels? Okay.
From The Biggest Loser, right? She's
From
one of the
Biggest Loser,
trainers.
the fitness trainer from Biggest Loser. She was quoted on Insider Magazine saying that it was in direct response to weight loss medications, saying that the results are temporary and don't do it. Just go exercise more and eat less. And I think that's especially ironic coming from someone who made her name on shaming people for their obesity on national or maybe even international TV. And all those people have now regained their weight back, because we know that's what happens when someone is not throwing you up on stage, stripping you down, and fat shaming you. So what would your response be to Jillian Michaels today after you've been through this journey? Some of you for 6 weeks, some of you for 3 years, and some of you for some time in between.
I can answer that. I would say that, boy, if everybody could have a paid trainer, 365, 24/7, that might be a little bit different. But, for the everyday working person like ourselves, and folks going to college, people getting out of the military, sometimes it's just not in the cards. And I had to tell myself that, because it was really hard on me. Well, I'm going to take the easy route out. Boy, that was not the easy way out. It was really hard because it took 3 years to get to the operating table for me.
I mean, there was skepticism even in your own house.
Yes.
Right?
So absolutely. Yeah. They didn't want me to go under and this and that. I'm like, you know what? I'm really just doing it. I got to do it for myself. No matter how good I ate, no matter how far I ran, no matter how much I ran every day, it just wasn't changing. And so sometimes you have to be okay with making a change that is different. It's out of your box. And that, for me, was bariatric surgery.
Cool. Anybody else want to throw something on that?
Well, for me, my family also was totally against it. And I had tried every weight loss under the sun, including, the prescription diet medication, which really never helped. And so that's where I was to the point that I've got to do something, and I can't do it. I've tried everything. And now, of course, my husband was very supportive. So with my family members, I've just had to say, I did this for me. Okay, because I'm becoming unhealthy. And, already my knees feel better with arthritis. And so I'm already feeling healthier. And so I just had to not talk to some family members, and still haven't talked to some. because they're just convinced I'm going to gain the weight back. And I'm just going to prove you wrong. I'm like, no, I'm not. I'm not going to do it. I've been on this journey too long. And I do want to see my grandchildren whenever I have them, whenever one of my children has them. And so that was hard for me, having family members tell me, well, you're going to gain the weight back. And so I'm just here to prove them wrong. But it was difficult. It was very difficult. But knowing my husband supports me, and of course my son and daughter are very supportive, and so I've just had to live with that with other family members. But other than that, I feel like I know I did the right thing, and I've lost the weight to prove it already. So, and I know the journey will continue. So, but it was difficult. It was difficult. So.
Yeah.
I agree with her. I had family members that really put me down for having the surgery and talked about it, and oh well, if you just set your mind to it, you could lose the weight. You're just not trying. You just don't want to. Look what you eat. Look how you diet. You don't get enough exercise. Eat the right food. And even when I had the surgery, I hid it from some of my family members. So because I knew that they would have something bad to say about it. But like she said, I did it for me. And
Yeah.
I think her audio cut out.
uh-oh. Can you hear me?
Yeah.
Yep, there we go.
Sorry, cut out there for a second.
The other day I was at one of my daughter's house, and she said, Mom, I want to show you these pictures I found. And she pulled them up, and I'm like, oh my God, they were right before I had my surgery. She said, you look so sad. You look so unhappy. I said, my God, look at me though. I had showed a before picture to one of the girls that I work with, and it had one of my daughters in the picture with me. And she said, well, I know that's your daughter. She said, is that your grandma? I said, no, honey, that's me. I mean, the difference is when I looked at those pictures the other day and look in the mirror now, I'm like, that was another person. That was just another person. I mean, I looked way older. I didn't care how I dressed, what I looked like, because I had just almost lost all hope of ever getting the weight off. Just like, oh, well, I'm just going to be big the rest of my life, and this is the way it is, So, but, it's a struggle. It's a struggle every day to bounce back and to keep it off. You have to work at it, and it's not the easy way out at all, which is what a lot of people tend to say. Oh,
Yeah.
you're just doing the easy way. And even some of my family now, they'll see me eat something and they're like, oh, well, you're going to stretch your stomach out, or you're going to gain all your weight back, or you're going to do this, or you're going to do that, but you have to keep on keeping on every day, So
Yeah.
it's definitely worth it. It's worth the work, worth it.
So we'll finish up. That's awesome. I think we've got a lot of great perspectives here. I just want to finish up with one quick thing. If each of you could quickly just debunk one myth, one thing that people told you would happen and hasn't happened after surgery. Charlene, you first.
Oh, snap. I don't know. A lot of, yeah.
I was going to say, give everyone a second to think about it. I would like to respond to Jillian Michaels. I have something to say. No one's surprised.
Go for it.
So, first of all, thank you all so much for sharing all of these things. I think that it could really be honestly said that talking about weight and talking about weight loss surgery might be a more sensitive topic than politics at Thanksgiving. And I appreciate you all for sharing with us. One thing I do when I'm seeing pre-op patients, when I see them for that pre-appointment before surgery, I say, bring your family, or we can do it, through telehealth right now. We'll group call them in. Let them put me on the spot. They can say things to me like, is this safe? What's really going to happen? Ask me those questions they might be afraid to ask the patient. You can put me on the spot. You're not going to hurt my feelings. I'm tough. I did a surgery residency. I'll be fine. So I try to help the patient not be the person receiving all of that concern.
Yeah.
And I think for most families, that is coming from concern. They want you to be healthy and they want you to be alive. When it comes to Jillian Michaels, there's a ton of research coming out now from the National Diabetes Center about people losing weight and regaining weight over time. And there was a big article about it in the New York Times that I just pulled up online. Let's see. It's from 2018, actually, May 2nd, 2018. And it's talking about after The Biggest Loser, their bodies fought to regain weight. So for anyone who's kind of struggling with that, if I just do diet and exercise, that might be a good article to read. And it looks like it's publicly available because I just pulled it up on my office computer. It's that struggle is always there, but when we are metabolically manipulating the system with weight loss surgery, we're more effective than diet and exercise. That's what I would tell Jillian. Okay, now you guys hopefully have had time to think about your answer for Dr. Kukrage's myth debunking.
Well, I was told, and I have an aunt that just had to have revision surgery after her. She lost a lot of weight, so everybody's been like, "You're gonna gain your weight back. It's gonna happen." I think it's the way you go about it. So I think being mentally prepared, and I think taking your time when you decide to do this surgery and preparing yourself with when you have the right people to back you up and your support system, and then you have the right set of doctors. So, you have the doctors at minimally invasive, then you also have the dietitians, and you have even the my insurance made me go and kind of do a therapy thing. It's like making sure you have the right set of tools and people to use and to talk to, and then just even the group, even though we haven't been able to meet for over a year, but having that group where you can talk to people about it and share different things to eat is able to keep me where I'm not eating and making bad choices, because I see what other people are eating. And even on days that I make bad choices, I correct myself because I'm like, oh, dude, I need to not, because I'm going to get down the rabbit hole and that'll be bad. So in the time that I even eaten bad things and I was nervous about it, when Dr. K went in to do something, he's like, your stomach's still cool. He's like, you're fine. Every time when he came back out and he checked with me, I was like, oh, awesome. So it's okay, you can have a little bit of something every now and then. You can live a life. You don't have to be I'm never going to eat this stuff again. It's just being responsible and making good decisions and stuff. I'm having a little bit of coffee. This is my coffee.
It's not like there has to be a last meal. And
that's what people were like. And that's kind of what I was freaking out about before I had my surgery. It's I'm never gonna eat this stuff again. I need to eat this stuff right now. So I went before I started my diet. I was like, I'm gonna eat loaded cheddar fries, bro. This is happening. Me and one of my coworkers went and got this big order of loaded cheddar fries at my work and I was like, I'm gonna eat these, and this is happening. It's the last ones I've had, and actually those were the last ones that I had because I haven't eaten anymore since then. But
you could. You could, if you had.
I could have a little bit, but it's it would be a bad rabbit hole because I like fries. So I was you learn your limits. So I think just learning yourself and stuff. But I mean, I'm not going to gain all the weight back, and knowing that and having that in your head and being mental, keeping that mental, because it's very mental.
Yeah.
Learning yourself, but you don't have to give up everything. You're fine. If you want to have a little sliver of cake, eat your cake sometimes. It's okay.
Okay. Anybody else want to throw anything in the mix?
Somebody told me once that I wouldn't. You're gonna fall off the wagon on your vitamins. I just think you're not gonna take that. Wrong.
Yeah, I tell people put them next to your toothbrush. So as long as you remember to brush your teeth, you'll remember your vitamins.
Yes, and so I actually really take pride in taking my vitamins because I know that like if I do that every single day in the morning and in the nighttime for the ADEK for the 8X for DS patients, like I know that I'm still it's a mental thing, like you said, Charlene. Like I am still taking care of me, like that, and that's what I'm here for. I am the only one who can take care of me, so I need to make sure that I have these on order ahead of time before I run out, and everything like that. Just preparing and knowing, like, hey, if I can't bring my lunch, I know exactly where I can go if I have to get something, and I know what I'll get: grilled versus crispy. Making those like conscientious choices and not getting a large, because Lord knows we can't eat nothing anymore. Even 3 years out, I can't eat a large nothing or anything, you know. So it's all small and this and that, and I still don't do straws. So, and I know some family members who have had surgery who say, "Oh, you'll be able to drink out of your straw." Well, I don't want to because I know that air going back into my stomach could potentially expand it. So I just don't do straws. So I got a lot of straws in the truck.
Right, straws are bad for the environment anyway, so we're good.
Right.
Yeah.
Yes. But Dr. K, thank you so much for having me. I actually do have to go if that's okay.
Yeah, of course. Thank you so
Yeah.
much for joining us.
Don't worry, we're going to be calling you to make a importance of vitamin commercials. You're
that's
going to be
true.
our
Okay, yeah.
spokesperson.
I'll
It's
do
awesome.
it.
All
Thank
right,
you,
Noah.
everyone. And good luck
Thank
to
you.
everybody, especially you that just had your surgery. You're doing awesome.
Yeah.
Thank you.
Bye.
Bye, Madonna.
Dolores, Francis, any other parting words of wisdom?
Well, for me, I think one of the biggest myths was that I was cheating by having the surgery. And
That it was the easy way out in some way.
Yeah, that it was my easy way out. And, you know, even though I've pointed out the years of all the dieting and ups and down and how really diet pills are not good for me. So anyway, that's the easy way out. And it certainly isn't. So, I mean, I'm so glad I did it, but you know, it's a journey that I'm on, and I know I just have to continue with myself, staying on it, like she said, with her vitamins. I try to be very diligent about that, and then just knowing I'm doing the right thing for myself, just to keep on keeping on, I guess. So, but that for me was the myth that, you know, I'm cheating by some reason by having surgery.
Gotcha. Definitely not cheating. You're doing the best thing for yourself.
Yes.
Yeah.
Absolutely.
All right, guys. Well, we appreciate you showing us today what your journey has been. I think we probably don't share your stories often enough, and I know that it takes a lot of confidence to be here, and we really do appreciate that. You know, this is not an easy step to make, not just having surgery, but coming on and showing your face to 7,000 strangers in the world, telling your story. So we know in the next hours, this will be seen by easily 1,000 people. And we hope that all of you guys who are listening have enjoyed this week of live events. Admittedly, we missed yesterday. I got stuck in the operating room unexpectedly. So we will make up for that soon. But thank you all for sharing your stories, for sharing your journey, and for sharing it with us. And we really appreciate everything that you guys are doing.
Thank you.
Thank
We
you.
appreciate
Thanks,
y'all.
everyone.
Y'all are the
Thank
best.
you, Dr. K.
Thank you, everybody. Thank you.
Thank
Happy
you.
Saturday, everybody.
Thanks. You too.
Thank
All right.
you.
Bye.
Bye-bye.
Bye.